you, I'm sure, who is based at San Francisco General Hospital. And Jackie's somebody I've known ever since I was a resident here. And you know, it just seems like the same every time I see her. I feel like I'm transported back to my internship years. In a good way.
In a good, okay,
the good aspects of
internship.
Because I think Jackie's always been, you know, she does great work. Not only, I mean, she's an example of a, you know, that UCSF faculty whose work is not only helping us with new knowledge, but also is helping to advocate for special populations. And I think that's what she's going to talk about today, is that prison population that she's spent a large part of her career working with, not only from a research point of view, but importantly from a clinical advocacy point of view. So Jackie's professor of medicine, and thanks so much for coming.
Of course, my total pleasure. Thanks, Peter. I have to remember that transport thing. I think I first met you, maybe you were interviewing for ID with David Bangsberg.
No, it was before that. It
was even before that? Okay,
yeah,
all right.
internship, yeah.
I do a lot of AIDS, so just like 2 more words about my background. I'm a general internist by training, and I did my MCH when I was in medical school, except I didn't quite finish the statistics class, so I never can put the actual MPH letters up. So don't be like me, like finish the damn statistics class. And then I came out here for Robert Wood Johnson's clinical scholar. It was at the time when we had kind of like the Doris Duke projects, where it was a fellowship for people who had finished their general medicine or psychiatry or surgical training and really focused on research. And then over the years, it seemed like I was always drawn, as my mother noted, to, it's like, nobody can be housed or insured, and it's like, no, and I don't want them to be washed, and really, if they're completely mentally ill, that's even better. And over the years, it did seem like a sort of morph from focusing on homeless, where there were a lot of people who had histories of incarceration, and now I actually work at the methadone clinic 2 days a week, so I'm very interested in the intersections between mental illness and substance use issues and linkages to care, and that's really been part of the themes with the incarcerated populations, I think, is both the work that you can do with the population while incarcerated, and then the work around integrating back into the community. That's enough. Oh, and then I've really focused on HIV/AIDS, so I'm in the AIDS division. And probably I ran into Peter because I was probably calling him up, begging him to help me. As a general internist on the HIV consult service, those tricky, weird, foreign infections, you always want to be really good buddies with your ID people, so I'm sure we had some bonding over that. I wanted to ask you, and then the last part is that I'm now a vice chair, which sounds really fancy, but it just means you look at even more applications for one of the committees on human research here. There's about 4 committees. More than that, if you think about the specialty committees for radiation safety, and there's actually a separate committee for all genome-related projects. And so with that hat, I thought I would talk a little bit about incarcerated population research and some of the special issues, but also really talk about some of the special issues related to Committee on Human Research and protections of these exquisitely vulnerable population type patients. And hopefully, I suspect that will easily take the hour out. So it's, no, this is what I want to do. Yeah, so nothing to disclose, which is both the good news and the bad news. I wouldn't mind if people wanted to 20,000 or whatever they get to give the big talks, but nothing going on so far this year, or even last year. So I'm curious about you guys. Has anybody in their, pre-coming to, I know it's like it's everywhere, right? I think Kim shut off some of the screens so my ADHD wouldn't flare up and not know where to look. But so have any of you done work teaching, worked on projects, been involved in any formal way in the jails or prisons? Undergraduate, volunteer stuff on your way to med school, none of that kind of stuff? Yeah.
I helped with the Marine AIDS project and some of the clients that were coming through in the legal exchange program.
Was that recently?
That was 2 or 3 years ago.
I think the Marine AIDS project was going into the Marine jail.
Yeah, they are. So one of my coworkers would go in and do a lot of education with that population. I never got the opportunity because I didn't go through the security clearance. We worked with them once they were out.
And we're not gonna ask you if there was anything about the security clearance that you were like worried. We never check with the audience of like, or when we're hiring people to work in the jails, we just put it out there that you will have to have security clearance, and so, you know, those tricky past live bad behavior things that you might not have taken care of are gonna come up, but, you know, you just deal with it and let us know, and we'll bring you right on as soon as that goes through. So we won't put you on the spot. It was probably just too much fingerprinting and that you didn't get a chance to do it. That's exactly right. So I was going to ask you in a minute about some of the projects you might do. It's interesting because often there are people that have, you know, had some relationship with jail or prison, either because they had parents that were lawyers and they would go in to sometimes interview people, or we had once I had a class where somebody had a family member who had been in and out. But so that you're tabula rasa, and that's great. Although, okay, admit it, who watches those cop arresting prison lock you up shows? No, what were you thinking I was going to ask?
Orange is the New Black.
Oh, Orange is the New Black.
So was
Oh,
your
so
favorite?
that's actually the name of a show. Is that what it is?
Yeah.
It was like okay, I thought you were just being hip. I'm gonna have
Definitely have to watch
to.
it.
Yeah, is that right? So is it set in a jail or prison?
It's a prison.
It's a prison.
Women's
Okay.
prison.
No, yeah, right. Oz, did anybody watch Oz when that was on? That seemed like an awful show. I couldn't even like get through a whole episode.
Oh,
You loved it, yeah. So was it nearly as violent as it sort of seemed? Oh, it was violent. I sort of screened that out after, you know, residency in New York and working in the ER there. I was just like, no, I can't distinguish TV from real life. So. But if you're looking for projects and you're looking for populations, honestly, you should really seriously consider doing projects in jails or prison. Because the 5 bigs are there. And I thought, you know, I kind of made this up for this talk. But the more I think about it, the more I think I should really think this through a little more carefully and probably write it up somewhere, because you know, what do you look for successful projects? I mean, you need big numbers, right? You need a lot of people, unless you're doing a really rare disease or you're set, you never end up getting enough of the numbers that you want on your research project. So if you are interested in jail or prison, you're not gonna have any trouble with the big numbers. Like, right this minute in the United States, there are over 2 million people locked up somewhere. Like, I can tell you where they are, more or less. I mean, there's an amazing amount of movement between one jail and another, and we'll talk a little bit about like San Francisco situation, but so you get over 2 million people locked up right this minute. Those are the end of 2011 data, but the data hasn't changed for end of 2012. 7 million people actively involved in the criminal justice system, which means they're either locked up, like right this minute, or they're on parole or probation. They have to be checking in with their officer on a regular basis, or they're gonna end up back in jail or prison. So you get 7 million right off the bat. And the estimate is there's almost 11 million people in and out of some kind of institutional lockup setting every year. So I couldn't even find the number in the US who have ever been locked up. But it's like, it's gotta be 30, 40 million people. I mean, it's true that the same people often end up going back in and out. But as far as just raw numbers, I'm telling you, incarceration, orange is the new black, as they say. So big disparities, so if you have any interest in disparities research and issues around diversity, you've got it in every way you want to talk about it with respect to both racial disparities and socioeconomic disparities. I don't know, I have some numbers I think I'll show you, but there's something like, what, 14% of the U.S., 13-14% of the U.S. population is African American. But the prison population, prison and jail, sort of use them interchangeably, but they're very different. It's something like 38-40% of the population is African American. So even if you just scratch the surface on racial disparity stuff, it comes out so obviously that what we're doing, it does not in any way reflect the society that we live in. So that's another big thing. And disparity research is something that I think we have a lot of interest in around the impact of health and disparities. So big disease concentration, I mean, it's an ID fellow's dream, right? It's like the perfect storm, the movie. You take a bunch of folks that use drugs and are mentally ill and haven't gotten much health care and have been, dropped out of school at a young age and low literacy. Like, what would you name the top 3 or 4 big ID issues in jail or prison population with just what I've just told you? Hep C, in spades, something like California, 60% of the California's 160, maybe it's down to 140,000 California state inmates have an antibody positive for Hep C. So like you're done, your randomized trial, you got it all set right there, but just with, frankly, a couple of the jails, or a couple of the individual prisons, there's like 3,000 people per prison. So Hep C is huge. Give me a couple others that are big in incarceration settings that you could imagine. So tuberculosis actually is a very interesting one, partially because we have such a large foreign-born population, Latino population. The data out of the San Francisco jail a few years ago was, do you know what the background rate in the United States is? So looking at TB exposure, not necessarily active disease, but TB exposure, somewhere around, correct me if I'm wrong, but like 6-7% was around the background rate. In the San Francisco jail, this was about a decade ago, but that population hasn't changed, it was 30%. So again, if you're looking for a bunch of people to do TB preventive therapy on, great place to check in. And then there's one other one that comes up quite often as far as looking at either actually having the infection or being at risk for the infection. HIV, exactly, one of my sort of favorites, partially because jails and prisons, it's a felony to use a condom in prison. Why would that be? How weird is that? A felony?
To use a condom?
In prison or jail.
To have possession of one or to?
Actually interesting, I guess they could bust you on having possession, but probably not because there's educational programs that'll like give you a condom. But they say they don't want to do condom distribution because people
Smuggle drugs in your body?
Exactly, well, or have sex. It's actually a felony to have sex in prison or jail. Whether it's consensual, not consensual, you look puzzled. Why would that be? Why can you imagine that?
Because of Oranges and New Blue.
I mean, felony just seems like a very strict, not a misdemeanor, it's a felony.
Yeah, no,
So,
it's
a
I mean,
serious
added time.
crime.
It's considered a serious crime. And the good side, the one side way of looking at it is the prevent, there was actually a whole legislation around rape prevention in incarceration settings because of the amount of what was strongly perceived to be non-consensual sexual practices, both among inmates as well as between guards and inmates. And so, so part of, if you want to stop something from happening, you make it a crime, so you make it a crime to have sex, so you make it a crime to have sex paraphernalia, and I guess that's probably the way to think of it. So having loose needles, having condoms, everything that implies that you might be sexually active. And yes, there's been a huge amount of hysteria about what could be transported into jails and prisons using condoms. Which there's actually a very interesting research project was done in the state because they put in 2 condom machines, and we won't get into the details of it, but if you're ever interested, they did a really beautiful epidemiologic observational study of what happened in the first year after putting condom machines in 2 different prisons in California. So, and I can tell you there was like no more violations of drug possession than there was before the condom machines went in. And then just to finish, so non-ID, there's all kinds of non-ID stuff, because again, remember, people are often, they're smokers, there's been low socioeconomic, so all the infectious diseases, cardiovascular disease, diabetes that we see in the general population, especially as people drop into lower socioeconomic groups. And then there's this very interesting mortality data. Like if you're, okay, I'm really interested in people dying. That's my deal. I want to look at people who are like, something happens to them and they go. All you have to do, there was a study actually done by a resident here, an R3 here for her R3 project. I mean, her R3 project was a cancer study I'm going to show you, but then she went as a fellow to Washington State and did looking at what happens in the first year after release from Washington State prisons. And the mortality was 5 times higher in an age-matched control group if you compared people that were released to people that had not been in prison in the previous year, and it was 12 times higher in the first month after release. And what possible sense does that make? Like, how could you imagine the data would look like that? I get out of prison and I'm 12 times more likely to die in the, I think it was 2 weeks to 4 weeks after release than somebody my own age. What's my mortality related to? Yeah.
Is there lack of healthcare?
So lack of healthcare, but more specific. Like, what would these people be dying of?
These infectious diseases?
Well, it's infectious is a little bit, there definitely was this sense, maybe some dumping, where, oh, geez, you know what, you really are on hospice level care, and we have to do a whole big thing if you die in prison. So let's do a compassionate release. Let's just release you. Oh, you're about on time. Let's just get you out, and then you die, in a hospital or a nursing home. People died of overdoses. The highest cause of mortality was overdoses, and then there was actually an amazing amount of violent death. So whether it was you finally running into the gang members that you hadn't gotten along with in prison, or related to repeating a crime and getting caught. But so very high mortality rates associated with some of the populations. Big finance, there's been lots of articles written about how we spend more in California on prisons than we spend on education, and that's actually true. We're talking something like $7 billion a year is the prison budget, and that's including healthcare as well as like all the stuff with the employees and pensions and just the moving people from prison to prison. And then I think big effect potential. So there's so much more room to do better that you almost can't do worse. So anything you want to do as an intervention study around linkage to care, around improved health care, around education, they always come out looking good. It's very interesting that way. So I'm telling you, the five bigs, they've got it right there in spades. So if you're not sure what you want to do for a project, just give me a call. Some quick statistics. This is from the Bureau of Justice Statistics, which makes a lot of data available. So epidemiologic studies using data sets are like carte blanche. It's very easy to get approval to do them, and they've kept data sets back, I think it's like 12 years now or maybe longer. So some of the statistics, like the rates of incarceration in the US are the highest in the world, and that's actually down a little bit from what it was a few years ago, 480 per 100,000. There's actually been a slight decline in the population just in the last 3 years. But most of that's in California, so again, California researchers, and most of that is because, do people know why? Why have everybody's obeying the law more now in California? No, yeah. You know why there's been this drop?
I don't know, maybe people are being convicted less like for drug charges.
That's exactly right. So there was a whole big, actually went to the Supreme Court, and the Supreme Court said, the overcrowding in California is so intense that there's no way you could have a constitutional appropriate level of health care. Like, this is violation of 8th Amendment rights to have so many people crammed in such a small amount of space. So they forced a decrease in the overall population. And one of the ways you can decrease the population is to not put so many people in. So as people got arrested, I have a patient, that guy probably spent at least 4 to 5 months every year in jail. Sometimes we'd get sent out to prison. He always got sent to the mental health facility because he would just lose it completely and have to be in like special lockup. He has not gone back all year, and believe me, he's not using any less crack. It's just that they're like, it's not a violent crime. It's more a nuisance crime, and so they're not bringing him back in, which is why most of this drop nationwide is all about California, not bringing people back in. And then what they call realigning, moving them into the jail. So there's fascinating projects to be done looking at what happens in a jail, which is the local county facility, when suddenly people who would normally be spending their time in prison are now going to spend their 1 to 2 to 3 year incarceration time here or in community lockup. So that's just some interesting statistics. And then the other disparity thing I thought was fascinating is the highest rate. So if overall 480 per 100,000, but the really big numbers are in the South, where they have up to 890 per 100,000 people locked up of their population. And that's in big contrast to like Maine, Minnesota, and Rhode Island. So you may conclude that being in warm places makes you more bad behavior than being in cold places, but I kind of doubt it. I don't know.
What about LA versus San Francisco?
LA versus San Francisco. LA does have the biggest single jail facility in the country. Right, so the Twin Towers are, I think it's 10,000 people can be locked up in the Los Angeles jail, neck and neck with Rikers Island in New York City. So I don't know, that's cold versus hot. But San Francisco's nothing, it's like 2,000 is the census, and actually the census has been a lot lower recently. Oh, and then here's state prisoners, 35% white, 38% black, Hispanic 21%. Oh, yeah.
I just have a question about the differential rates in the two areas. I mean, how much of that is due to the ethnic disparities? I mean,
Yeah.
because Maine, Minnesota, and Rhode Island are pretty more
You would
homogenous.
yes, exactly. I mean, there is this migrant stream of Hispanics that up through like Minnesota. I don't know about Maine so much. But I think in all these places, and I do know this data that where we have, say, 38%, the state prisoners, that's state prisons throughout the country, 38%. In the South, it'll maybe be more like 60%. So I think some of the numbers come up because the disparity gets worse. The actual numbers are smaller just because these are smaller states and smaller prison populations, but their rate based on the amount of free living population is so incredibly high. So anyway, just as, like I said, as background. Okay, so I thought this would be fun, just to break it up a little bit, is turn to something next to you and name 3 studies you might do with incarcerated people. Like just, I got 2 minutes, I need 3 things, quick. Like there might be, based on what I said, based on what's on TV, what's some studies that you might want to do?
It's okay, I don't either.
You get another minute because Kim's running to get a marker. I can just see some ideas.
So I mean, let's say you have novels that you want to do, like, treat HIV like
when they're really like at one release, or maybe like a couple weeks later.
Okay, great. All right, future researchers of America. Let's hear a couple. Favorite ideas for prison or jail projects. We can start with this group. One idea.
we weren't 100% sure, but I mean, like, you have like a novel drug that you wanted to do a clinical trial on, for example, for any one of those big infectious diseases. You could, I mean, there's a lot of patient enrollees there. You could have good follow-up if you knew what their sentence was.
When they were going to be in there. Okay. Okay. Oh, that's like, I'm so happy you mentioned that actually. So we'll come back to that one. So like a novel drug where you're just trying, like curing their hep C maybe with a couple of doses of a medication. Okay, so that's a really good one. You guys, did you have one you'd want to contribute or any?
Yeah, I mean, I just had a kind of simple idea to look at a cross-sectional study of proportion that have received, age recommended screening across the board.
A recommended or
Age, like
age
for
recommended.
colon
Okay,
cancer
so like
all that.
yeah, age. It's like preventive studies.
Yeah, exactly.
Screening. Okay, that's actually another excellent one for a reason you'll see in a minute. And it is an aging population. It's very interesting. They I think the oldest person in the San Francisco jail, believe it or not, was like 90 years old, kept getting picked up for, and this is unfortunate, on sexual assault charges, and was very demented, but very aggressive toward grandkids in the family, so a big mess. But yeah, right, has he had his age-appropriate colonoscopy? It's a great place to ask the question, or other stuff, and we'll come back. I mean, the cervical pap smears, preventive therapy. How about you guys? Did you have an idea of one, like a favorite of the three?
Oh,
No, you two. Yeah, you're on the spot. Yeah.
I was just going back to the outreach that we used to do at the Million AIDS Project.
Mhm.
Our colleague would do education around transmission of diseases through needle use. So
Mhm.
maybe studying what the effect of that might be on that population once they were released, and if the education they received affected in any way the harm reduction or the usage of harm reduction strategies.
So it's specifically around harm reduction, but education, like this, it's this golden moment to do educational opportunities. Let's get a couple more up here. Like you guys,
So I'm applying into emergency medicine, but I thought it'd be interesting to look at this population in the ED with respect to number of resources ordered, or like things like time to analgesia.
that's a really, so someone that's, because the jail will bring them over to the ED for clearance. You won't let anybody in that, you think is like profoundly hypoglycemic or has a tuberculosis. So you're right, so it'd be almost like the ED practices of, of booked or inmates, or, right, do they get less pain meds, do they get more pain meds? Do they get stuff recommended to them that the jail can actually give them? So actually that'd be very interesting, and there's been some interesting studies looking at stuff like that. So more like implementation or observational sciences. One or two more, yeah.
I'm really interested in the social reintegration of these inmates
What do you
after
mean
they
by
go
that?
Like, I feel like the barriers are so high once you leave the kind of microcosm of the jail. Like, how do you get a job, reintegrate, get housing, food, not get sucked back into a gang?
Yeah, so really all this stuff that's about like staying in the community and not coming back in, so recidivism studies, so housing, linkage to health, that's also, so yeah, the whole like integration and linkage stuff, there's a lot of interest in that. And for a while there was a ton of funding to do that too. And one last group, if I could get an idea from you guys.
That was actually ours.
No, still,
Yeah,
what's
Yeah,
a good
I
one?
guess we could throw in like rates of incarceration.
Right,
Relative to the support system.
Okay,
that
oh,
these
that's-
people have.
Yeah, and how the duration of incarceration is affected their
Yes.
reintegration.
So using duration as a predictor, yeah, so you're getting even more advanced, like look at the factors and then analyze for the factors.
Did you say that?
It'd be a tough one to come out and say, like, listen, the shorter they're in, the better it is. I don't know how that would sell with the capital punishment crowd, but it's not a bad thing to sort of try. So actually, you guys have some great ideas, and part of what I love about it is that I put down here some of the projects that we've actually done. And I definitely say the we on this. I am definitely a researcher light. I do best with a partner. So over the years, there's been nursing partners, medical students, residents who've done all these various projects looking at things related to prevention. We've done more focused on, I don't know why the laser doesn't show up on the screen. It just shows up on the wall. But anyway, related to recidivism, so some of these reintegration and not coming back in. We've actually made recidivism one of the outcome of a study using case management for HIV patients. There's a bunch of, we haven't done so many of the Hep C or staph infection ones, but for a while LA jail had something like 600 or 700 cases of staph infection over the course of a 6-month period. So again, you could do your drug study, but you could not do a novel drug study. So among the protections, and we're going to switch into IRB in just a minute, is some of the protections says you cannot use anything on prisoners that is not completely like FDA approved as a standard care. You can do randomized trials, you can definitely have control groups, but it has to be that it meets the criteria for minimal risk or minimal problem intervention, not minimal problem intervention, but minimal risk of the intervention. So novel drug studies don't end up meeting that criteria, although we can always get them through in the free world. You do a special permission